Hello everyone. Good morning. Welcome to Zomeo Classroom. I am Dr. Tarana Malik and I am here to present an interesting case of acne. So let's start. This case is of a 32-year-old female teacher by profession who came to us with the chief complaint of pimples on both the cheeks since the past 1 year. She said that her complaints had become worse since the past 2 months. The eruptions on her face were reddish, inflamed, and had severe burning sensation along with itching. She told us that her problem started after she applied some cream on her face last year. She also mentioned that every time the weather changes, these pimples become worse. So these are the symptoms that she told us as her chief complaint. She told us that she has acne, which started since last year but had worsened since 2 months. Now, moving on to her physical generals, she told us her appetite is reduced. She does not feel like eating a lot. She had a craving for sour food. Her sleep was refreshing and she had dreams that she did not remember. Thermally, she told us that all her complaints get worse during winter. She wants covering throughout the year. She bathes with hot water throughout the year and is sensitive to cold air, which means that the patient is chilly. Now, when we are investigating a case of acne, we also have to consider the menstrual history of the patient carefully, as a lot of times in a female, acne is a result of an underlying hormonal imbalance. So let us have a look at the menstrual history of the female. She told us her periods were regular. The cycles lasted for 28 to 30 days and the duration of the cycle was for 4 days. The menstrual blood was red and there were no clots present. She had slight pain during the first day of her period. So here we see that her pattern of a menstrual cycle is regular and there is no abnormal bleeding pattern associated with the menses. So there is probably no hormonal imbalance or an underlying issue responsible for acne. Moving on to her life situation, she told us that she has studied MA or Master of Arts and is a teacher now. She told herself to be very ambitious. We also noticed during case taking that she was talking a lot. She told us that she does not get angry but weeps easily as she is an emotional person. She also told us that she does not like it when somebody criticizes her. She got married 6 years back, but the marriage was an abusive relationship. Her husband used to physically abuse her, but she told us that I did not tell anybody about this as it was an arranged marriage and I had to honor this because of my parents. But eventually things did not work out and she finally decided to divorce him. She was strong-willed and also an obedient person. She had a strong sense of responsibility. She, like we just saw previously in her history, that she tried to make the marriage work. She said that it's my responsibility to make the marriage work as my parents have arranged this marriage, which shows us how strong the sense of responsibility is in this patient. She told us that when she is upset, she does not like to be consoled. She gets aggravated by it. She was an introverted person and she also had a feeling that no one cares about me or she felt neglected. Now, I hope you've noted down all the symptoms you thought were characteristic as I was describing the case. Moving on to the diagnosis, her diagnosis is acne vulgaris And the classification of this disease is dynamic chronic miasmatic disease with fully developed symptoms. Now that we've covered the diagnosis and the Hahnemannian classification of this disease, let us move on to the totality of symptoms. We've considered ailments from disappointment because of her history that she gave us. She had a relationship where her expectations were not met. Her husband was abusive. So obviously there was a lot of disappointment associated as an underlying feeling. She got anxious over small matters. She was stubborn. She had fixed ideas. The patient herself told us that she is ambitious. She had a strong sense of responsibility. Consolation aggravates her complaints, and she had a neglected feeling. So these are the mental symptoms that we thought were characteristic in her case. Moving on to her physical general symptoms, she told us that she had a craving for sour food and she is a chili patient. Last symptom that we've considered in our totality, which was characteristic, was acne aggravated by change of weather. Now that we have the totality, let us have a look at the conversion of these symptoms into rubrics. Ailments from disappointment was converted as disappointment, deception, aggravate, ailments from, and it is found under the mind chapter of complete repertory. Anxious over small matters is found in the repertory as anxiety, trifles about in the mind chapter of complete repertory. Stubborn is found as obstinate, which is a synonym of stubborn, or headstrong under the mind chapter of complete repertory. Fixed ideas is found as ideas fixed under the mind chapter of complete repertory. Ambitious is found as ambition, ambitious under the mind chapter of complete repertory again. Strong sense of responsibility is found as responsibility, strong or two under the mind chapter of complete repertory. Consolation aggravates is listed as consolation, sympathy, ailments from aggravate under the mind chapter of complete repertory. Neglected feeling is found as delusion, imaginations, neglected he is under the mind chapter of complete repertory. Craving sour we find under the generalities chapter of food and drinks under sour, acid, desires in complete repertory. And lastly, we've considered a general rubric for acne aggravated by change of weather, as we did not find any rubrics particularly associated with acne aggravated as change of weather. So what we've considered as weather change of aggravate, which is found under the generalities section of complete repertory. Let us start recording the rubrics one by one using Zomeo. The first rubric we've selected is ailments from disappointment. Now to find it in the repertory, all you have to do is press Command S and a search bar opens. Here we type disappointment and press on search. Now you can see all the rubrics containing disappointment open, and we select the rubric that we want is disappointment, deception aggravates, ailments from. We select the symptom and now it's recorded. The second rubric is anxiety over small matters, which is converted into a rubric as anxiety trifles about. We again press Command S and type anxiety trifles. press on search and select the first symptom. This symptom too is recorded. The next rubric we have is stubborn, which was converted as obstinate as a rubric. We again do the same thing, Command S, type obstinate and click on search. We select the second rubric, which is from the complete repertory, and this symptom is recorded. The next symptom is fixed ideas. We will again do the same thing, Command S, fixed ideas, and press on search. We select the first symptom reflecting in the search result. This too is recorded. Now there's another way of recording symptoms using the Zomeo software. You can select the symptoms from the repertory list itself and record it. For that, we click on the repertory module and repertory list. Now we see that various list of repertory is open and complete repertory, being the first in the list, is open by default. If we want to search for a symptom within the complete repertory, all you have to do is click on the search bar, search symptoms, and type the symptom here. So then according to our totality, the symptom we want to record is ambitious. We type ambitious. And you can see ambitious is the first search result reflecting. We select it and this too is recorded. Next rubric we have is responsibility strong. We type responsibility strong and we find the rubric that we want, responsibility strong or 2. Okay. Now this symptom is also recorded. The last symptom that we have is consolation aggravates. For that we type consolation and here we have the first rubric in our search result, consolation, sympathy, ailments from, aggravates. We select this rubric. Now if we want to see the symptoms that we've already recorded, all we have to see is click on the first icon, which is view repertorization, and here you can see all the symptoms that we've recorded. Up till now, we have recorded 7 symptoms and we still have 3 more symptoms remaining. Now going back to our repertory list, let us record the remaining symptoms. We have to click on repertory, select the repertory list, and here we have the list of repertories open again. We can again go on the search symptom option and type neglected, as that is our next symptom that we wish to record. So here we see the second symptom, which is delusion, imagination, neglected, he, she is. We press on select and our symptom is recorded. Moving on, there's another very easy way of recording a rubric using Zomeo, which is the quick repertorization. We find this option in our repertory sheet on top. Here you can directly type a keyword or a symptom and press on record and the symptom will directly be recorded. So our next symptom is desire sour or craving sour. We type on desire sour and record it. You can see that the symptoms from the generality chapter, food and drinks, sour desire is already recorded. The last symptom in our totality is change of weather aggravates. So here we type change of weather and press on record. Here again, the rubric directly is recorded. This rubric was the closest to the keyword that we had typed. Now we can see in the repertory sheet that natrum mur is the first remedy which is covering all the symptoms in our totality. But even ignatia is pretty close to our totality. So how do we differentiate between two remedies which we feel are kind of covering almost all the symptoms in a totality? Now to find out the remedy closest to our case, we can do something known as cross-repertorization, wherein we select the symptoms which are most relevant to our case or the symptoms that we feel are very important to the case. We can find cross-repertorization shortcut in the filters tab. We click on it and now we can see our symptoms that we've already recorded, from which I will select disappointment, obstinate, ideas fixed, consolation aggravates, delusions neglected, desire for sour food, and change of weather aggravates. After selecting the symptoms, we press on apply, and now we can see that natrum mur is the only remedy which is covering the symptoms we've considered in cross-repertorization. This way, we are sure that this remedy is the closest to our totality. Now that we have our remedy, what else do we need to speed up the cure? In cases like acne, it is important to instruct the patient about certain do's and don'ts as well as diet instructions, because patients end up using a lot of commonly available over-the-counter medications which can either aggravate or worsen the case of acne. Diet is important, as a healthy diet will help in faster healing and also help in correction of an underlying hormonal imbalance if present in the case. So what are the instructions we can give to our patient in case of acne? We can find it in Zomeo listed under diet and regimen, which can be found in the utility tab. We select diet and nutrition. Here you can see that a list of clinical conditions are present on your left hand side. Acne is the second condition. When we click on acne, we can see that causes of acne are listed, signs and symptoms of acne are listed, along with the dietary management, which consists of a list of foods to be avoided, like oily fatty food, chocolates, ice cream, cakes, white bread, sweets, fried food. It also has certain instructions for the patient, like avoid breaking your pimples as it will lead to secondary infections, avoid using scented soaps and chemicals on the face. It also has instructions that the patient can do, like wash your face frequently, use non-greasy makeup, use natural cleansers. It also has certain home remedies suggested, like a gram flour face mask or instructions to take steam or yoga in order to make the blood circulation better. Below, we can see what the patient needs to consume in diet, which is obviously drink plenty of water, drink lots of juices, coconut water, eat lot of fresh fruits and vegetables, increase dietary fiber, eat whole grains and refined flour. So in this way, you find a whole list of dietary instructions as well as do's and don'ts, which you can even print and hand it over to your patient. Now, what does Hahnemann say about diet and regimen? Hahnemann has specifically mentioned about patients' diet and regimen and what impact does it have on the health of the patient, the action of the remedy, in aphorism 260, where he talks about certain noxious influences and other disease causing errors in the diet which often pass unnoticed. He has made a list of foods like coffee, fine Chinese, herb teas, spiced dishes, and other foods, and also lifestyle related problems like a sedentary lifestyle or frequent indulgence in mere passive exercise, which can be a problem in the case, which needs to be pointed out to the patient so that the action of the remedy is not hindered and we get faster results. We can find this aphorism in Zomeo listed under reference books. When we click on reference book, we find various headings like materia medica, philosophy, therapeutics. You can either manually select philosophy and search for organon of medicine, or what you can do is type organon in the search bar, and you can see that all the books containing the word organon have appeared in our search results. We select the 6th edition of Organon of Medicine by Samuel Hahnemann. Here we want to read the aphorism number 260. We select on chapters and scroll down to select aphorism number 260. As you can see, the aphorism with its footnote is visible to us. You can also read various other reference books apart from philosophy like Materia Medica, Therapeutics, if in case you have any doubts related to the case. Now moving on to the prescription, we prescribed Natramur 1 mg single dose to the patient along with SL200 TDS, which was given for 15 days. When the patient returned to us, she mentioned that she was feeling better, even though there were slight breakouts of acne present. Overall, she was given 4 doses of Natramur 1 mg over 3 months, and the patient showed remarkable improvement, which we can see in the pictures. So now you see the patient, when she came to us, had multiple acne on the face that were tiny, red, and even the skin had a very rough looking texture. After the treatment, this is what the patient's skin looked like. You can see the acne have completely gone. There is very little scarring, and even the quality of her skin has remarkably improved. So what do we learn from this case? Understanding the patient's situation helps us in identifying the causation, especially in cases when the patient does not mention it clearly during case taking. We also learned that when we select a right similimum, only a single simple remedy is enough to bring about a cure. We also learned about the importance of diet and regimen and do's and don'ts, especially in cases of acne. So that is all for today. I will see you soon next time with another interesting case.